My name is Michael Miedema, Director of the Nolan Family Center for Cardiovascular Health at the Minneapolis Heart Institute Foundation. In this video, we're going to talk about the new weight loss medications that have recently been receiving significant attention. These new weight loss medications are called GLP-1s. GLP stands for glucagon-like peptide, and this class of medication was originally developed for diabetes because they lower blood sugar. However, an important side effect was that these medications resulted in significant weight loss, and so more recently, they have been studied in individuals without diabetes. GLP is a naturally occurring hormone in the body that serves multiple functions. One of the main ways that GLP-1 works is by slowing the rate that food moves through the stomach and intestines, which helps people feel fuller longer and with less food. In addition, GLP-1 acts on the brain to reduce hunger. These effects result in decreased caloric intake and weight loss. People who take these medications can lose around 12 to 20% of their body weight in a year. Beyond weight loss and reduced blood sugar, these medications have also been shown to reduce blood pressure and triglycerides, as well as improve HDL or good cholesterol levels, all of which lead to improved cardiovascular health. In fact, there is a recent trial showing that taking these medications can lead to less heart attacks and strokes over time. This landmark study highlights the potential of these weight loss medications for improving cardiovascular health. There are multiple GLP-1 medications currently available for diabetes and weight loss, and several others are being studied. Most of these medications are in a pre-filled, self-injectable pen, and most of them are given once weekly. Importantly, these medications were not developed for cosmetic weight loss. They are intended to improve cardiovascular health. These medications are for people with an elevated BMI and elevated cardiovascular risk, including individuals who have suffered a prior heart attack or stroke, or those with multiple cardiovascular risk factors, such as diabetes, high blood pressure, or elevated cholesterol. As I mentioned, these medications are getting a lot of attention, and with lots of attention frequently comes misinformation. So we're going to try and stick to the science and discuss 5 myths about obesity and these new weight loss medications. We are, without a doubt, in the midst of an obesity epidemic, with 73% of Americans either overweight or obese. The average weight of individuals in the US and across the world has been steadily increasing for the last 40 years. This is true for both men and women, and people of all ages and ethnicities. The reasons for this increase are complicated, but it's very clear that it is not solely related to changes in diet or physical activity. Genetic and environmental factors are definitely playing a role as well. I have many patients that follow a relatively healthy eating pattern and are quite active, yet still struggle with weight gain. Because of this, we need to consider other interventions to help with weight loss, especially in individuals at elevated cardiovascular risk. Some of the concerns raised about the GLP-1 medications is that they are new and experimental, but that is simply not the case. These medications were developed over 20 years ago. Many patients that have been on these medications for over a decade, and the long-term safety data to this point looks very reassuring. So while use of these medications for weight loss in people without diabetes is new, the medications themselves are not experimental at all. Anytime we talk about using a preventive medication, safety is probably the most important aspect. In preventive cardiology, we never want any trade-offs. If we lower somebody's risk for a heart attack but give them significant side effects, that doesn't make any sense. We only want to reduce risk if we can do it safely. GLP-1 medications do come with risk for potential side effects, but importantly, side effects, if they occur, are mostly mild and rarely severe. Because GLP-1s slow gastric emptying, they can lead to side effects like nausea, bloating, stomach pain, and other gastrointestinal symptoms. There are case reports of more serious side effects, such as complete obstruction of the intestine, but this effect, while obviously quite serious, appears to be quite rare. For most patients, the risk of potential side effects is outweighed by the potential benefits. While some individuals do have to stop the medication, the gastrointestinal side effects can often be avoided by adjusting the medication dose. Concern has been raised that once started, these medications can never be stopped. That simply is not the case. While most patients do continue these medications long term, some people are able to return to the lowest dose or even stop them and maintain a healthy weight. There's definitely no mandate that they must be used long term. Because these medications are new, they are expensive. But I do not agree with the idea that these medications are too expensive for routine use, especially in individuals at high cardiovascular risk. There's potential for healthcare savings with these medications if enough heart attacks, strokes, and other cardiovascular complications are avoided. Many private insurance companies have been hesitant to cover these medications, and understandably, given the significant cost involved. However, I think we have enough evidence supporting their use that they should be covered for patients living with obesity at elevated cardiovascular risk. This is probably the myth that I find most frustrating. I have heard and read many people hint that taking these medications are somehow a substitute for a healthy lifestyle. Nothing could be further from the truth. Without a doubt, these medications work best when combined with a healthy eating pattern and exercise. In fact, as patients lose weight, they are often able to be more active, which makes the medication even more effective. A healthy lifestyle will always be the foundation of cardiovascular health. But for some individuals, that foundation isn't enough to adequately address their weight and their cardiovascular risk. And in that setting, use of these new medications should be considered and even encouraged. If you are prescribed a GLP-1 medication, it's always a good idea to consult with a registered dietitian nutritionist to discuss ways to ensure healthful eating habits for long-term weight loss and quality of life. Thank you for your time. If you think you might be a good candidate for one of these medications, please see your primary care provider or preventive cardiologist to discuss your cardiovascular risk and your options for treatment. I hope you found this video helpful. Please feel free to share it with any colleagues, friends, or family that you think would benefit from this information. Thanks again, and stay heart healthy.